Hey there and welcome back to another short episode of Clinical Decision Making series. Today we're going to discuss treatment strategies of pelvic fractures in brief. In dealing with pelvic fractures, two main points has to be kept in mind. Number 1, stability of the patient. Number 2, stability of the pelvic ring. According to these 2 points, patients can be subdivided into 4 main categories: unstable patient and unstable pelvic ring, unstable patient and stable pelvic ring, stable patient and unstable pelvic ring, and finally, stable patient and stable pelvic ring. If there is a suspected pelvic fracture, an AP radiograph should be done, as it's included in the primary survey. From the AP radiograph, one should identify if the pelvis is mechanically stable or not. Now let's start with the first category, which is the unstable patient and unstable pelvic ring. Using pelvic binders if available, or a circumferential pelvic wrapping around the 2 canters should be applied. Now, pelvic binders or pelvic wrappings are not recommended for LC fractures since it may cause further displacement of the fracture, and in patients whose posterior pelvic ring has been completely destroyed, and that's where the C-clamp comes in handy. If the bleeding is not controlled after that, seek angiographic embolization because most probably the bleeding is arterial in nature. That's it for today, and as always, thanks for watching. Till next time.